This video of mine is about gastroesophageal reflux disease, that is GERD, or you can simply call it as GERD. Okay, this occurs when stomach acid frequently flows back into the tube connecting your mouth and stomach, that is known as esophagus. The backwash acid reflux can irritate the lining of your esophagus and cause different symptoms. Earlier I posted a short video about GERD on this channel. I hope you have already seen that video, and today I am going to discuss this illness in detail. Well, many people experience acid reflux from time to time, but if it is frequently occurring, especially if it starts occurring more than twice a week, then you should consult your doctor. Most people can manage the discomfort of GERD with lifestyle changes and over-the-counter medications, but some people with GERD may need stronger medication or surgery to ease symptoms. Now I will discuss the symptoms of GERD. Well, common signs and symptoms of GERD include a burning sensation in your chest, which is commonly known as heartburn, usually after eating, which might be worse at night. You can experience chest pain, difficulty in swallowing, regurgitation of food or sour liquid, sensation of a lump in your throat. If you have nighttime acid reflux, you might also experience chronic cough, laryngitis, new or worsening asthma, or you can also experience disrupted sleep. You should seek immediate medical care if you have chest pain, especially if you also have shortness of breath or jaw or arm pain, because these may be the signs and symptoms of a heart attack. You should make an appointment with your doctor if you experience severe or frequent GERD symptoms, or if you take over-the-counter medication for heartburn more than twice a week. Now I will tell you about the causes of GERD. GERD is caused by frequent acid reflux. When you swallow, a circular band of muscle around the bottom of your esophagus, which is known as lower esophageal sphincter, relaxes to allow food and liquid to flow into your stomach. Then the sphincter closes again. If the sphincter relaxes abnormally or weakens, stomach acid can flow back into your esophagus. This constant backwash of acid irritates the lining of your esophagus, often causing it to become inflamed. Okay, now I will tell you the risk factors. Conditions that can increase your risk of GERD include obesity, bulging of the top of the stomach up into the diaphragm, that is known as hiatus hernia, that is another illness. Okay, this is another risk factor. In pregnant females, because there is an increase in weight, then that can be also a risk factor. Then there is the condition known as scleroderma, which is a connective tissue disorder, that can also be a risk factor. Also, some people have delayed stomach emptying, that can be a risk factor. Now I'll tell you the factors that can aggravate acid reflux. These are smoking, eating large meals or eating late at night, eating certain foods. There are certain food triggers such as fatty or fried foods, drinking certain beverages such as alcohol or coffee, taking certain medications such as aspirin. Now I will tell you the complications. Over time, chronic inflammation in your esophagus can cause narrowing of the esophagus, that is esophageal stricture. Damage to the lower esophagus from stomach acid causes scar tissue to form. The scar tissue narrows the food pathway, leading to problems with swallowing. An open sore in the esophagus, that is esophageal ulcer, can be a complication. Stomach acid can wear away tissue in the esophagus, causing an open sore to form. An esophageal ulcer can bleed, cause pain, or make swallowing difficult. Then it could be there could be another complication, that is known as Barrett esophagus, which is a precancerous condition in the esophagus. While damage from acid can cause changes in the tissue lining the lower esophagus, these changes are associated with an increased risk of esophageal cancer. Now I will tell you about the diagnosis of GERD or GERD. Well, your doctor might be able to diagnose GERD based on a physical examination and history of your signs and symptoms. To confirm a diagnosis of GERD or to check for complication, your doctor might recommend certain tests, which I should tell you. The first test is upper endoscopy. Your doctor inserts a thin, flexible tube equipped with a light and camera, that is endoscope, down your throat to examine the inside of your esophagus and stomach. Test results can often be normal when reflux is present, but an endoscopy may detect inflammation of the esophagus, that is esophagitis, or other complications. An endoscopy can also be used to collect a sample of tissue, that is biopsy, to be tested for complications such as Barrett's esophagus. Another test is known as ambulatory acid, and that is pH probe test. A monitor is placed in your esophagus to identify when and for how long stomach acid regurgitates there. The monitor connects to a small computer that you wear around your waist or with a strap over your shoulder. The monitor might be a thin, flexible tube, that is catheter, that is threaded through your nose into your esophagus, or a clip that is placed in your esophagus during an endoscopy and that gets passed into your stool after about 2 days. Then another test is known as esophageal manometry. This test measures the rhythmic muscle contractions in your esophagus when you swallow. Esophageal manometry also measures the coordination and force exerted by the muscles of your esophagus. Then we can also carry out the X-ray of your upper digestive system. X-rays are taken after you drink a chalky liquid that coats and fills the inside lining of your digestive tract. This coating allows your doctors to see a silhouette of your esophagus, stomach, and upper intestine. You may also be asked to swallow a barium pill that can help diagnose a narrowing of the esophagus that may interfere with swallowing. Now I will tell you the treatment. Your doctor is likely to recommend that you first try lifestyle medication and over-the-counter medication. If you do not experience relief within a few weeks, your doctor might recommend prescription medication or surgery. Now I'll tell you some about some medications which are over-the-counter available. First, antacid that neutralize stomach acid. Antacids such as Mylanta, Rolaids, and Tums may provide quick relief, but antacid alone won't heal an inflamed esophagus damaged by stomach acid. Overuse of some antacid can cause side effects such as diarrhea or sometimes kidney problems. Medication to reduce acid production. These medications known as H2 receptor blockers include cimetidine, that comes with the name of Tagamet, famotidine, that comes with the name of Pepcid, and nizatidine. These H2 receptor blockers do not act as quickly as antacid, but they provide longer relief and may decrease acid production from the stomach for up to 12 hours. Stronger versions are available by prescription. There are medications that block acid production and heal the esophagus. These are a very well-known medicine, and these are commonly prescribed, and I have seen so many of patients, they are healed by only these medication. These medications which are known as proton pump inhibitors. These are commonly used and they are a very effective treatment for reflux. These are stronger acid blockers than H2 receptor blockers and allow time for damaged esophageal tissue to heal. Over-the-counter proton pump inhibitors include lansoprazole and omeprazole. There are other proton pump inhibitors such as esomeprazole, which comes with the name of Nexium, that are available through prescription. And these are very well tolerated medicines. These medications sometimes may cause diarrhea, but if you take for a very long time, okay, generally these medicines are safe. Maybe there are some side effects of headache and vitamin B deficiency, okay. Also, there is a medicine that is known as baclofen that may ease GERD by decreasing the frequency of relaxation of the lower esophageal sphincter. Side effects might include fatigue or diarrhea. Okay. Now I'll tell you some surgical and other procedures. GERD can usually be controlled with medication, as I told you before, but if medication do not help or you wish to avoid long-term medication use, your doctor might recommend fundoplication. This is a procedure in which surgeon wraps the top of your stomach around the lower esophageal sphincter to tighten the muscle and prevent reflux. Fundoplication is usually done with a minimally invasive, that is laparoscopic procedure. The wrapping of the top part of the stomach can be partial or complete. Links device. A ring of tiny magnetic beads is wrapped around the junction of the stomach and esophagus. The magnetic attraction between the beads is strong enough to keep the junction close to refluxing acid, but weak enough to allow food to pass through. The Lynx device can be implanted using minimally invasive surgery. Then there is a new procedure known as transoral incision-less fundoplication, that is TIF. This new procedure involves tightening the lower esophageal sphincter by creating a partial wrap around the lower esophagus using polypropylene fasteners. TIF is performed through the mouth with a device called an endoscope and requires no surgical incision. Its advantages include quick recovery time and high tolerance. If you have a large hiatal hernia, TIF alone is not an option. However, it may be possible if TIF is combined with laparoscopic hiatal hernia repair. Now I'll tell you some lifestyle and home remedies which are very important to note. These lifestyle changes may help reduce the frequency of acid reflux. You should try to maintain a healthy weight. Excess pounds put pressure on your abdomen, pushing up your stomach and causing acid to reflux into your esophagus. So you should control your weight by adopting a healthy lifestyle. Okay. Also, you should stop smoking because smoking decreases the lower esophageal sphincter's ability to function properly. Elevate the head of your bed. If you regularly experience heartburn while trying to sleep, place boards or cement blocks under the feet of your bed so that the head end is raised by 6 to 9 inches. If you cannot elevate your bed, you can insert a wedge between your mattress and box spring to elevate your body from the waist up. Raising your head with additional pillows is not so effective. Do not lie down after a meal. Wait at least 3 hours after eating before lying down or going to bed. Eat food slowly and chew thoroughly. Put down your fork after every bite and pick it up again once you have chewed and swallowed that bite. Okay? Avoid foods and drinks that trigger reflux. Common triggers include fatty or fried foods such as tomato sauce, alcohol, chocolate, mint, garlic, onion, and caffeine. Also, you should avoid tight-fitting clothing. Clothes that fit tightly around your waist put pressure on your abdomen and the lower esophageal sphincter. Here I should tell you that there is hardly any role of alternative medicine because no alternative medicine therapies have been proved to treat GERD or reverse damage to the esophagus. Some complementary and alternate therapies may provide some relief when combined with your doctor's care. You should talk to your doctor about alternative GERD treatments may be safe for you. The option might be include herbal remedies like coarse and chamomile are sometimes used to ease GERD. Herbal remedies can have serious side effects and might interfere with medication. You should ask your doctor about a safe dosage before beginning any herbal remedy. Relaxation therapies, techniques to calm stress and anxiety may reduce signs and symptoms of GERD. Ask your doctor about relaxation techniques such as progressive muscle relaxation or guided imagery.